The most recent winner of The Bachelor has revealed she froze her eggs when she was 27 years old. So what is the process for freezing, and is it right for everyone?
Yeah, joining us to discuss this morning is Dr. Kuneck. Thank you for being here, sir.
My pleasure.
Thanks for being here.
Now, I guess before we get started, we're talking about frozen eggs. At the beginning of the show, we talked about Sofia Vergara and frozen embryos. Two very different topics here.
Correct. When you're freezing embryos, you are freezing an egg that's already been fertilized. When you're freezing an egg, it is just a single cell. We've been freezing embryos since 1984. Eggs have been frozen since 1986, but really it wasn't considered to be non-experimental actually until 2012.
Wow. How interesting. So talk about the process of freezing eggs. How does it work?
Well, anybody that's going to be freezing eggs is looking to go through a process that's almost like IVF, where they are put on drugs to make them multiply ovulatory. They're brought into a procedure room where under an anesthetic, they use a transvaginal ultrasound to retrieve the eggs just through a needle. Under normal IVF procedure, the eggs then 4 hours after the retrieval are fertilized and over the course of 5 days grow into embryos and are put back into the woman's body. With freezing eggs, we get the eggs out, and with it we then strip the eggs off what's called the cumulus cells. Then they're frozen in a process called vitrification.
And once they're frozen, how long can they stay that way?
It's really indefinite. The issues, like in a plane, it's takeoff and landing. Once they're frozen, they can stay indefinitely that long. The problems that may occur are just in the freezing process or in the thawing process.
Interesting. I know that women who are listening right now want to know if they're able to do this. What goes into the process of deciding, can all women do it or certain women? Talk about that.
Any woman can do it.
Okay.
It's a question of when is it the right time to do it and what are the reasons for doing it. There's a field that has developed within our own specialty called oncofertility, which is really what was the driving force for learning how to do egg freezing was, and that's women that were diagnosed with cancer that were not married or did not have children and wanted to maintain their reproductive function if indeed they went on some kind of chemotherapy or radiation therapy that could destroy their egg quantity. So that was the first driving factor that was doing that. The next thing that was at issue within IVF is that there, for personal reasons, for religious reasons, there would be people that would say, I only want to make a certain number of embryos, and I'm not willing to freeze embryos, so any embryos that are made have to be put back inside of me. So you end up in a situation of the risk of possibly multiple pregnancies if you put in too many. So before 2012, or it could probably happen earlier than that, but before 2012 was noticed to be non-experimental, they just have to lose those eggs. Now we have the ability to say if you only want to mix sperm with 3 eggs, we can go ahead and try to fertilize those and freeze the extra eggs so that at some later date you can come back, we can thaw those eggs, fertilize those, and go ahead and do an embryo transfer.
Well, at the top of this conversation, we led into this with Bachelor winner Whitney made the decision to do this in her 20s. You mentioned that it's good for most women, but it depends on the condition of I guess, the health of the woman and her age. What is the safe and appropriate age or age range for a woman to do this?
Well, any woman that is in reproductive age can do it at any point in time. When you start to think that it is reasonable to consider is probably between 30 and 37. Going up to the early 30s, the eggs are maintaining, with most women, eggs are maintaining their integrity. Eggs start to not perform properly starting at about age 32. Starting at age 37, it becomes more of an issue of the eggs truly not performing appropriately in terms of the way they divide. When you start getting beyond 37, up until 37, 38, 39 is still a reasonable time, but the rates are not going to be as good. And once you're at 40, it's probably not highly beneficial.
Interesting. I think a lot of people want to know real quick how expensive it is, and then is it covered by insurance at all? I'm guessing possibly not. Does it depend?
It depends on the policies. It really truly does depend on the policy. As far as the expense, if you talk, it's not cheap.
Okay.
If you talk about doing this with all included between the monitoring and the drugs and the procedure, it's about a $10,000 procedure.
Okay.
Very good. And real quick, I'll give you the 20-second way to answer this, which might be way too short. What should a woman really think about before she does this or proceeds with this? Are there any questions that she should start to ask?
It's personal.
It really is.
It truly is a personal issue. And for some people, it is that there's a medical reason for doing it. For others, it is something where they are trying to say that I really do want to protect my fertility, and I'm afraid of not meeting the right person. But it is both a financial issue, it's a religious issue, it's a personal issue.
I agree. All right. Dr. Paul Kuneck, thank you so much for being here this morning.
Appreciate it.
Great to hear from you.
Yeah, very
Pleasure.
informative. Thank you.
Thank you.